Dyscalculia is its numerical cousin, I dare call it. And it's a specific learning difficulty that actually makes it hard for people to understand numbers, to grasp mathematical concepts, and even do some simple everyday calculations like telling time or even counting money. And it's not just about intelligence, it's or efforts. The brain simply works differently. We're going to talk a bit more about that, and I have joining me over the phone lines a doctor to help me unpack this important subject. His name is Dr. Charles Ahiagbe, and he's going to help us explore what exactly this concept is, or this particular condition is, and how it affects both children and adults, and most importantly, how early identification and empathy can actually make a world of difference. Doc, good morning. How are you? And welcome to the Business Breakfast on ZED.
Good morning. Good morning. I'm good. How are you?
Yeah, I'm doing very well too. Thanks so much for making time to speak to me this morning. Hello.
Hello. Thank you for having me.
All right, great. So let's get into it. I mean, to start us off, what exactly, when we talk about dyscalculia, and sorry for the time, when we talk about dyscalculia, what exactly are we talking about?
For somebody who is not dyscalculic, sees 2 plus 2, sees 2 and understands it that bringing together two entities, like 1 plus 1 is there, that is 2. The other 2 is also 1 plus 1. And the addition sign means I should add it. And when I add it, I'm supposed to get another number, which means 4. The non-dyscalculic is able to process that. That's the person without dyscalculia is able to process that, understand it, and then is able to give the answer 4. The person with dyscalculia sees that and then is not able to understand it. It's like that language is foreign. It's foreign to him or foreign to her. So that person is able to understand it and then make sense of it. So it is neurobiological in origin, as you rightly said. It's not a problem with a poor effort or the person being lazy, right? It's probably not probably, it's neurobiological in origin. So it's not like the person is under a curse or something of the sort. It's neurobiological in origin. It's how the brain is wired. It's wired a bit differently than the typical person.
I see. But how does it differ from simply being quote and unquote bad at math?
Okay. So what happens here is that somebody who is bad at maths, right? After some tutoring, right? It could be due to poor exposure. The person is bad at maths, maybe due to poor exposure, probably poor teaching methods, poor learning methods, right? Maybe lack of interest. So such a person, after intense tutoring, after one-on-one lessons, extra lessons, motivation, that person is able to improve significantly, right?
Yeah.
In contrast to somebody with dyslexia, that person, dyscalculia, that person will not respond to the typical teaching and learning methods that would result in improvement of a non-dyscalculic.
I see. But is it considered a medical condition or maybe a learning disability or something?
Okay, so it's a learning disorder. It's not a disease in the rare sense of the disease. So it doesn't mean the person is mentally retarded. It doesn't mean the person is not intelligent.
Okay.
Actually, dyscalculics could have normal or high IQs. That's the intelligence quotient. That speaks about the ability to learn and understand and retain information. That person would have a high disease. It's not a disease in the pure sense of the word disease, but it's just a disorder that the brain is wired differently in them. So how the typical person would process information, they just can't process it that way. It's something that is without them. They can't process information that way.
Okay, so I'm sure then it means that it differs from one person to another. Can we say is it genetic in a way?
Yes. Yes, it's having parents with dyscalculia increases the probability of the offspring having dyscalculia too. It is
Mm,
neurobiologic in origin, as I said. So it deals with how wiring happens in the brain, how the brain is wired. It's wired a bit differently. The normal pattern, recognition pattern that the non-dyscalculic would use, and the dyscalculic has it wired or structured differently.
mm,
Yes, so it's not a disease in the pure sense of the word disease, right? But it's a condition. It makes learning, if the person is a pure dyscalculic without the associated condition, then it makes learning number-based information difficult. It doesn't mean that person is not smart. He can speak, she can speak fluently,
mm.
understand topics in science, environmental study, understand, be able to speak. But the problem is understanding number-based information.
I see. I see. So apart from the genetics, which means that it can be transferred from a parent to a child, what other causes are there? I mean, in terms of this dyscalculia.
Okay, so basically that is the leading hypothesis now. That's the leading hypothesis. The environment may play a role not in causing it, but in worsening the condition. As in, you're in an environment where the condition is not picked up early, you don't receive help early, then it continues to persist, right? But basically, it is neurobiological in origin.
Mm.
So that is like the leading hypothesis. But why it's that way, why it happens that way, we are still trying to understand why it happens that way.
I see. But how common is that? I'm going to come back to what you were talking about in terms of picking it up early. So it means that diagnosis and all of that. I will come back to that. But how common is that, especially among children in Africa or even Ghana? And yes, Ghana and Africa generally.
Okay, as you rightly said at the beginning, that it's something that we do not talk so much about, right? The awareness is not there, so a lot of attention is not being paid to, statistics in that regard. So I would say it's emerging. For this part of the world, but the global prevalence, which I think typically can apply here, is about 3 to 7%. That is with global stats, and I think we can apply them here.
No, how do you mean? 3 to 5% of what exactly?
Of learners
Okay.
of learners of school going age. So meaning you take any 100 school going, children of school going age. Out of that, you could have 3 to 5 of them, even up to 7 of them, having difficulty understanding number based information.
Mm, I see. But what are some of the early signs that parents or teachers should look out for in children who might have this particular condition?
Okay. So for one, it will depend on the age of the child, right, and whether or not that child has been exposed to, formal mathematical instructions. But for one, right, if the non-dyscalculic, there are 4 apples on the table, or 4 bananas, or 4 okros. You don't have to count, right? You recognize it immediately that is 4. You don't have to use your fingers and then maybe point at it 1, 2, 3, 4. But for the person with dyscalculia, for something like that, the person would actually have to move and count to be able to say it's 4. So that ability to accord subitize and it's not there.
Mm,
So that is one. Then I'm talking about people preschool and then early school going ages. They would have difficulty counting. Let's say 1 to 10, right? They would have difficulty doing that. The person may skip a certain maybe 1, then jump to 4, then jump to 7, then maybe mention a 2 somewhere after that. Just have it all mumbled and jumbled up. But let me be quick to say that the fact that the child is having that difficulty, just that alone doesn't make the child dyscalculic, right? It's a whole constellation. It's a diagnosis that's supposed to be made by specialists. So don't say because your child is doing this, just not being able to count well. So he has dyscalculia. No, that is not what you're trying to communicate. But
mm.
all these come together. The assessments are done to make the diagnosis. So that being mentioned, the difficulty counting, um, Then a difficulty with memorization, right? So that child is going to have a hard time with the times table, right? Two
Mm.
times two.
Yeah.
I mean, it's going to have difficulty memorizing it. So just it's just good we look at it as a language that is foreign, right? You see maths, you recognize a language like that you can understand, how you understand English, how you understand Tree, Ga, whichever language that there is. It's foreign to them. Probably if I put maybe Koine Greek in front of you or some ancient forgotten language, I mean, there's no way you can make sense of it, right? Because the mind is not able to. It's so for them with
Mm.
mathematics, right? It seems something very foreign, like you'd see a foreign language. It makes no sense to them. In contrast to somebody who doesn't have dyscalculia, so they would have difficulty. I mean, even to name the days of the week, right? They would have things that follow sequence, things that are sequential. They would have problems with that one. Have difficulty understanding that five represent five objects, or six would represent six bananas, right? That making that connection that okay, six fingers, that is six. They can't get that connection that a three plus two equals five
Mm.
is the same as five equals three plus two, right? They can't grasp that. They
I
can't
see.
grasp that. And mind you, it's not because they are lazy, they are not putting in enough effort that they are cursed. It's just that their brain is wired differently from the typical person.
Mm. Very, very interesting. I'm sure a lot of people don't know about this. And you talk about the education a few minutes ago. I think a lot of people don't know about, because back in school, and I was during the business brief segment, I was saying that back in school you see people that I mean, they are not too good when it comes to a particular subject, especially maybe maths, but they can do very well in other subjects. But the way they are treated is not the best.
Sure.
Did you grow up seeing that thing as well?
Sure. Yes. It happens, and um, that in and of itself may not be plain dyscalculia, right?
Okay.
Sometimes people have delays. Sometimes people have poor foundation in the topic. So such a person, you realize that with tutoring, with coaching, that person is able to improve, right? Probably
Mm.
came from a background where math was not taught properly. So such a person would improve. Yes, but there were people that you realize that I mean with the maths, and I mean when it's maths lesson, I mean they become anxious. Maybe they'll just move through the window when the math teacher is entering the classroom. Yeah, then that could be looking more like dyscalculia. And
Mm.
I don't think the awareness is out there enough
Enough.
to help them. We just
Mm.
brand them as being lazy. I mean, we know the words we use in our local languages,
Yeah.
right?
Yeah.
Just brand them as being lazy, being cursed, something of the sort, not
Mm.
realizing that they actually have a
A
condition that
condition.
that needs to be addressed.
I see. So it's very important that we do some more education in line with that. Okay, so how can it be diagnosed? Now you said parents shouldn't just jumping. I mean, once you see that your child is not doing too well, you think that is dyscalculia, but they should. I mean, it is supposed to be tested and proven. Are there some specific medical or psychological tests for that? How can it be diagnosed?
Okay, so with the specific learning disorders, it falls within the domain of the psychologists, the educational psychologists, the neuropsychologists. So as doctors, our interest would be in ruling out other conditions that may mimic dyscalculia, right? Probably the child is not able to understand the maths you are teaching him or her because he or she cannot hear, right? Or he or she cannot see properly, or he or she has thyroid issues that is affecting his or her cognitive ability. So our interest is in ruling out those conditions. When we do that, realize that the child has otherwise normal IQ, right? This is an intelligent child.
Mm.
I mean, able to learn, but just that there's a deficit in that part. That child doesn't have hearing difficulties, doesn't have vision problems, then would refer to the appropriate cortex, which falls within the domain of the psychologist, the educational psychologist, the clinical psychologist, um, uh, maybe a pediatrician specialized in specific learning disorders to maybe can help, right? So it's multidisciplinary, like little contributions from different people, different specialists. Yeah.
Okay, but there are no specific tests that anybody at all randomly can take to test to see
Good.
that.
Like maybe you could no. It's supposed to be done by specialists, right? Because they would do. I mean, part of the assessment would include an IQ test. I mean, hearing assessment, vision. So it is not like a specific test. Maybe you can sit online and then just take. I think some human interaction would be needed, and it has to be made. That diagnosis has to be made by somebody formally trained in that regard.
I see. All right, Doc, hold on for me. Let me just announce the phone lines in case anybody wants to get in touch with us. It's a very interactive show. Please feel free to send us a WhatsApp. If you're listening to this conversation, you have any questions, you have any comment, feel free to send us a WhatsApp on 0544 321019, 0544 321019, and then we'll give you the opportunity. I mean, I'll get to read your message for you. And you can as well call me on 030395661, 030395661. If you have a question, you have any comment you want to pass, please feel free to call me, and then I give you the opportunity to do that. We're streaming live on Facebook at ZFMGH, and also on YouTube at Z Multimedia. We're also on Instagram and X at ZFMGH. Please do all to engage our live stream and also engage our post there, and we'll read your messages for you. All right, Doc, let's continue the conversation. Now, some people actually do not get diagnosed early. You know, sometimes children struggle years before anyone even realizes there's a deeper issue. At what age can dyscalculia realistically be identified?
Okay, great. So typically the diagnosis is made after repeated exposure to formal arithmetic instruction, right? So the child is over 5 years, right? Has been in school, has been taught maths for probably over a year, and then we are noticing these trends, right? That maybe we don't see in other subjects. Then assessment can start from that age after formal repeated exposure. So this is not a child that is at home now that mommy is teaching 1, 2, 3, and then the child is. I mean, the child has not started going to school, right? That mommy is struggling to teach 1 to 10, and the child is messing it up and listening to this problem. Mom will be like, "Hey, my child has no, no. That
All
that is
right.
that is not it."
I see. Sometimes learning differences, I mean, of course, almost always they don't come alone. Sometimes they overlap. I want to know, can dyscalculia occur on its own, or does it even, often appear alongside some conditions like dyslexia or ADHD?
Okay, so yes, that's a good question. These don't. Sometimes you may have it as plain dyscalculia, right? But about 40 to 60% of the time, it would come with a friend, right? So you could have dyscalculia with dyslexia, right? You could
Yeah.
have dyscalculia with ADHD, as you rightly said. You could have dyscalculia with dyspraxia. It could come with other conditions, and then it's good. It's recognized as such, picked, and then treatment started.
I see. And okay, so very important that we take note of that. So that means that if we are diagnosing you of, I mean, we're getting to see that somebody has, if we get to see that somebody has dyscalculia, then there's also a likelihood that they might be struggling with some other things like dyslexia and also
Right.
ADHD. Okay, let's look at the impact on daily life. Now, maths touches almost every part of our daily routine. I mean, from paying bills to keeping time and all of that. Beyond the classroom, how does dyscalculia affect everyday life?
Okay, so as you rightly, said in the introduction and even now, um, the person would have poor spatial reasoning, right? So even telling time on the analog clock.
What is that? What is spatial reasoning?
Okay, so when you have the person doing math. So, for example, you could even have the person having difficulty telling his left from his right. Yeah,
I see.
it
It
gets
can
that
get,
deep.
yeah.
Yeah, yeah.
That's very serious.
Yeah, yeah. And then you could have the person having difficulty telling time, like the analog clock, right?
Mm.
You could have the person having difficulty identifying that, counting money, right? You'd want to count your money and know how much you have, right?
Yeah.
So probably that child, even as you rightly said, could be the mother can send the child to go and buy something. Maybe the child is 8 or 9, right?
Mm.
She would go and then the child will be cheated because the person doesn't have the ability to understand, or that ability to understand number based information is decreased, is or virtually not there, right?
Yeah.
So the child, we send the child with 50 CDs, tell the child go and buy maybe Oko 10 CDs, buy some condo 5 CDs. That child would come back and then just come back with 2 CD change, whilst you're
Mm.
expecting like 35 CDs, right?
Yeah.
So you'd have that difficulty with managing time, managing money, day-to-day activities, as I said, even knowing his left from his right, understanding sequences that this would follow that. So you give that child instructions: at 1 do this, at 2 do that, at 3 do that, right? And then you come back and then everything is just mumbled and jumbled up. It's because if the person is dyscalculic, it's because the person cannot appreciate or understand number-based information.
Mm. And the unfortunate thing is that, I mean, with what you're talking about, telling time and all of that, we think that the children are just dumb, you know.
Yeah.
Yeah, and I think that also affects them. How does actually living with dyscalculia impact the confidence or self-esteem, especially in school settings
Hmm.
of the children?
So in settings where the awareness is not up or out there, it's easy to brand that child or just box that child into the unserious bracket, right?
Mm.
Or something of the sort. That child will not have the confidence. He will not feel confident as his colleagues, because the teacher would hold the cane up and say 2 times 2. The person sitting next to him has said 4, right? And then he's there trying to understand how were you able to
To
do
do it.
that? How did you know 2 times 2 is 4?
Mm.
His confidence is affected, right? And when that happens that way, the confidence goes down. The person would have anxiety. Anytime it's time for math lesson, and the person is dyscalculic, he's looking for a way out, right? He starts shivering, starts fidgeting, starts playing with his own toys in some corner. If he can and has the opportunity, say, "May I go out?" And he never comes back until the the lesson is
It's
over.
over.
You
Mm.
see, so such a child, if help is not offered early, diagnosis made early, help offered early, it would persist even into adulthood.
Mm. Talking about adulthood, what I mean, how might dyscalculia be showing up? Because I mean, for students or for children, we are talking about math in class, 2 times table mental, as we used to call it back in school, you know, and all of those things. They will struggle with that. For adults who maybe they were never diagnosed, nobody got to know that they had any condition, and for some people, they're even hearing of dyscalculia the first time today, you know. How might that be showing up in their work or even their relationships?
Okay, so it's um, um, the same things we said, and even worse, right? Because as it progresses with age and the diagnosis is not made and help offered, that the person has so that person will still have difficulty managing his finances, right? Or understanding how much money he has, how much change he should get when he goes out there to buy something. He would always be cheated. He would always be cheated. Or if the person is selling, he would always be cheating people, right? And deny, you didn't give me 50 cedis, you gave me five. You would have that kind of back and forth. The person
Mm.
would have problems with time management. And with how our systems are structured, it would be difficult for that person to land a formal job. Why do I say this? He would perform, or she would perform poorly mathematics, right? And not be able to progress to the next stage. Probably will be able to get into SS, but will not be able to go beyond that level because of poor grades in subjects like mathematics.
And that is a
So
big problem in our
yes,
system.
exactly. In our setting, I
Mm.
mean, you cannot progress to any tertiary institution, and then, I mean, finding jobs would be difficult. If the job should involve maths, probably a cashier somewhere in some supermarket or something, you'd always be messing up the books, right? Always
Mm.
messing up the books.
Yeah.
You can't give good accounts, and then you'll be deemed unreliable. Maybe you're not a thief, probably you're not a thief, but then you'd have all that put on you. So it's going to cause lots of limitations, functionally and even socially.
Mm. I see. So it could be that there are people who had to drop out of school simply because they had this condition and nobody knew about it.
Yeah, yeah, yeah.
And I'm so sad about it this
Mm-hmm,
morning. I don't know, but yeah, for somebody might feel like they were very wetless. They are
mm-hmm,
wetless. They had nothing good about them and all of that
mm-hmm,
simply because they were battling this condition. And so,
mm-hmm,
if you're listening to us this morning and you probably know anybody at all. That might be exhibiting some of the signs that we are showing, then it means that we have to provide some support. Not us, but Doc. What are some of the best approaches to actually help people, children especially, with dyscalculia to be able to learn and also thrive?
Okay, so great. When the child is in the appropriate environment, remember we said the environment having an effect on the worsening of the condition necessarily causing it. If the child should find himself in a good environment where the condition is picked, I mean, between the ages of 5 and 7, and then the appropriate learning and teaching methods is applied for that child, I mean, they do amazing, right? Its effect and its impact on their life is greatly diminished. There's no cure. Let's say that, I mean, let's just get out of the way. There's no cure. There's no medicine you take or no surgical procedure that will be done that would cure it and make it go. But it's something that you can learn and then manage to live with if it's picked up early. If it's picked up early, because neuroplasticity is still ongoing. I mean, the brain is still growing. Let me put it that way. The brain is still growing. Alternative pathways, right, to carry number-based information can be developed. I mean,
Mm.
as the brain is growing, so it moves from maybe point A to point B to point C in the brain. That is the typical way. The child can be taught to make it move from A to maybe D before it gets to the C that we want. After a certain age, I mean, it becomes practically impossible, right? The person is an adult. Some help can be offered, but its effects and then the benefits will not be as pronounced as it would be in somebody that had it picked up earlier.
Mm. I don't quite get it. So maybe I should pose a question differently so you can explain it better
Okay.
for us. So let's say somebody has been diagnosed, all right?
Okay.
What kinds of treatments or interventions are actually available?
Okay. So once again, I leave this to the specialists in that domain, who are the neuropsychologists, I mean the educational psychologists, the occupational therapist. They would use a constellation of tools available to them, right?
Mm.
It could be multisensory, so it would not just be visual. They could include audio, tactile, like feel. In addition, right? They
Right.
could make them feel the number. This is three. They would have a way of teaching them that you don't feel numbers, right? I mean, you just see a no, it's three, but they would have a way of teaching them that we're making association. The plan is just to create alternative routes, right,
Mm.
for the information to be recognized, right? Because typically they are not able to pair the typical pathways that every other person uses. So all those teaching methods would want to employ tools that would enable the child bypass, as in shunt that resistance, and use alternative ways to make the child understand that. So they have a lot of tools, right? Even
Okay.
online, there are lots of tools that I mean, parents can log on, and after that, after the diagnosis has been made, right, to
Yeah.
help with care for their child. I think Khan Academy has an interesting program. I mean, with maths. I mean, there's mod maths. There's doodle math. I mean, the options out there are a lot,
A
are a
lot,
lot. So I mean,
right?
you just have to go on and check. Yeah.
Okay, all right. Doc, I have some questions here. Let me read this one and then you attempt it. So this is coming from Ben. Now, Ben didn't state where he's texting us from, but he says that can dyscalculia be cured, or is this something people learn to manage?
Okay, so
Mm,
there is no cure, there is no tablet or no known maybe surgical procedure that you'd or therapy that you'd gonna go to cure it, as in to no, there's nothing like that.
mm,
The person is born with that, and then that connection is there, right? But there are ways to manage it if it's picked up early, and then the person can have a normal or near to normal life or a near normal life. Yeah.
mm.
So there's no cure.
There's no cure, so you have to manage it,
Yep.
and they learn certain things to be able
Mm-hmm.
to do better
Yep.
in terms of all right. But what teaching techniques are most effective for, especially for children that identify with some of these things we're talking about?
Okay. So the our typical teaching and learning environment would not help, right? This
Mm,
person would need more dedication, and there are people trained in that. As I rightly said, the educational psychologists, we have teachers who are trained to use the tools available to them. It has to be one on one, it has to be tailored
okay.
individually to that particular child. So it's not like a one size fits all thing. It has to be
Mm,
customized. So this would require interaction with a specialist in that field to
mm,
actually sit down with the child, identify the child's problem exactly, like which part of number-based information does the child have most difficulty with, and then the approach or the solution starts from that angle.
mm. But as a country, do we have like special places for people like that?
Oh yes, yes. So because dyscalculia sometimes goes hand in hand with dyslexia, um, uh, centers where dyslexia is attached have some help for dyscalculia, and I think even Ghana Education Service has special learning I mean disorder unit that that has that. But is it pervasive? Is it widely available? Is
Mm,
it is it is it something you can just, I mean, no, it's not. Unfortunately, it's
mm.
not. But yeah.
I see. Because I mean, I ask that because can the average Ghanaian afford, that special uh, attention and all of that you're talking about? That's I don't know if you get what I'm
That's a
asking.
good question we'd have to look into. That's a good question.
Because once people are unable to actually afford and get all the necessary tools, the necessary people around their children and everything, they might just leave them, and at the end of the day, they become a burden to society. And I think that is something that we need to look at. All right. So
Hmm.
you talked about some assistive tools, right? You mentioned Khan Academy,
Hmm.
and you mentioned Doodle. Maybe more specifically, are there other ones you may want to add to that, just so that
So
anybody
there's
at all
mod
can look at?
maths. I mean, the treasure trove is I mean, online there are lot of lots of useful resources. If you just go on and then type in maybe your browser or your search engine, it would cough up a lot of useful options. But the very common ones are what I have mentioned: mod
Mentioned.
maths, Khan Academy, Doodle maths. I
Mm,
mean,
mm.
yeah, yeah.
I see. So how important is emotional support, especially from parents and teachers in managing this particular condition?
It does a lot. It's the difference. It does is like light and day, right?
Mm,
Because the child should be made to understand that this is what you have. You are not dumb. You are not foolish. You are not cursed. It's a problem you have, and then we are working at it, right? So the focus should be more on um, uh, progress, right? It should be more on effort, sorry, and not on progress. So when you see the child putting in the effort, there should be a lot of encouragement that
mm,
that should be given to that child, and not on effort. Oh, yesterday we did this, why can't you get it? No, lots of patience is required with such. And then if parents are aware, siblings would also be educated, right? So that they don't tease their brother or their sister with that condition. If teachers are, I mean, the awareness is increased, they would educate the classmates or other children in the class, other learners in the class, so that they, they understand that this is what this friend of us has, right? But
Right.
with the right method, with the right um, exposure, he would be good. So it's just like maybe you go and bring a child from Russia, right, that speaks only Russian, and then you put him in a Gan class, and they are teaching Gan. You see, it will take time and special attention with the implement of special tools to get him or her understand what is happening. He can understand, yes, he can, but he would need special help.
To be able
Yes.
to navigate that. Okay. Let me try and see if we can touch on a few other things before we go. But what would be the role of schools and educational psychologists in actually intervening very early in this?
Okay. So as we rightly said, if schools, I mean, the awareness is out there, right? I wished there could be screenings for children, right? Or teachers, I mean, asked to put more emphasis on picking and screening for children with these conditions. They ask the educational psychologist to see, right? And then the school would have a policy, right? I mean, make room, accommodate room. Those children should be given a little more time. When people have 10 minutes to submit their math assignment, they could be given 15, maybe 20, right? Just to encourage the effort so they don't get frustrated. So it's more to do with education, more to do with education, more to do with having more of these specialists in the field, right? That will be able to assist on a hands-on with children suffering from these conditions.
I see. Right. Exactly 20 minutes, 21 minutes after 9. This is a business breakfast on ZED 101.9 FM. And this morning we're talking about Dyscalculia. And my guest is Dr. Charles Ahiagbe. And he's helping us understand exactly what this condition is about. And we've had a great conversation so far. But you can feel free to send us a WhatsApp if you want to ask any question or make a comment. Please feel free to send us a WhatsApp on 0544 321019, and then I give you the opportunity to share your thoughts with us. Also, you can call us on 0303956641, 0303956641. Yeah, that's a number you can call, and we're streaming live on Facebook at ZFMGH. Please feel free to drop a message in the comment section and we'll read that for you. We're also on YouTube at Z Multimedia. Please drop a comment there and we'll engage you on that as well. So Doc, let's talk about some of the myths and then the awareness creation you talked about a while ago. What are some of the common myths and misconceptions that you would like to correct this morning about dyscalculia?
Okay, so for one, the dyscalculic, and that is somebody with dyscalculia, is not cursed. The dyscalculic is not lazy. The dyscalculic is not dumb, right? Far from these.
All right.
That is not what dyscalculia is. And then also, it's not maths dyslexia, right? Which is, it may be similar but a different entity, right? So there may be people who would have difficulty understanding maths, not because they have dyscalculia, but because they have dyslexia. They can't
Okay.
understand the instructions that is going with the written instruction that is going with the maths assignment, right? So that is more like maths dyscalculia. Maths dyslexia,
Dyslexia.
which is an
Right.
entirely different entity from um,
From dyscalculia. Right.
from dyscalculia. Yes.
Okay.
So
So it means
Putting
that,
things in
sorry.
their rightful place
Mm,
would help with treatment and with help. It's treatable. It's a lifelong condition, but it's treatable when picked up early.
mm,
So I think this should be the role of parents, right? I mean, parents should be on the lookout. Try and engage your child. Try and talk with your child. I mean, you know some one, two, three, right? You know some ABC. You can write 1+1 on a piece of paper. Like, try engaging your child. You can bring two pieces of bananas together, two fingers. Try and engage your child. Ask your child. I mean, how many oranges are there? I mean, this child should be like 7, right? 5 to 7, there about. You don't expect the child to be, I mean, 3 oranges. You should be able to just see and say three. You shouldn't go one, two, 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 three. Uh-huh. So try, engage your child. See this. Are you getting persistently poor results in mathematics? But then other subjects are okay. I think those are pointers that you shouldn't just sit down on and assume it's normal,
mm,
right?
yeah.
And so you should seek help. It's not that the child is poor at math. It's not the same as being poor at math too. So
Right.
yeah.
Now, many people actually believe that maths, and quote on unquote, maths is just not for everyone, or math just isn't for everyone. How do we separate that from a genuine learning difficulty?
Okay. So lots of people find maths challenging, and I agree. But the problem there is it will not extend. I mean, with this calculus, with the basics, right? Probably the person is having difficulty with calculus, right? But can understand that 5 plus 5 is 10, and 3 plus 7 is 10, right? Can
Mm,
understand that, can count, understands that 5 is greater than 3 and 7 is greater than 5, can appreciate that, right? That I mean, with that, I mean, we've taken Dyscalculia off the table, right? it's it's something to do with the person's affinity,
right.
or just that natural tendency not to um, uh, grasp or like the subject mathematics. But yes, so it's not like you understand the basic maths, but then the very complex ones, maybe some differentiation and some some other topics like that,
Mm,
then it's like, okay, it's Dyscalculia. No, no, it's not.
okay. So very, very important. But why is there still so little awareness about this, even among educators? I know that there are people that do not know anything at all about this. Why is that so?
So I think maybe the fact that the awareness is not there, right? And our tendency to quickly brush off things and qualify it. You know what you do not know, you would want to give attributes, right? That may not be true. So you would want to rubbish it off as the child being lazy, right? You just put it that way. Oh, on your serious, it's lazy. Then you just put that child in that bracket, and then the child is left to continue. And then that confidence, that poor confidence the child has on the math lesson may move down and trickle into other subjects too. So that child will just feel like, school is not for me, I can't do it. You get it. And that. So
Mm,
it's more of the awareness and the fact that even when we are seeing and not being aware, we will not know that this is what we actually seen, and then this is the series of steps that has to be taken, that have to
mm.
be taken to
All right.
to solve it.
Doc, I understand you have to go. What can governments or education ministries actually do to make learning more inclusive?
Okay, so that is good. So I believe with these problems, the solutions should start from the top and trickle down, right? So it would be nice if we have more educational psychologists in the field, right? More of them. Like we feel their presence
Mm,
in the field. Probably I don't know how GS does their stratification for schools, but
right.
a cluster of schools may have an educational psychologist assigned to them
Mm,
who would be involved with the teachers, right, in picking up these children with the problem we are discussing about. that would go a long way. What if on our final exams, on our BEC, on our WASI, people who have been diagnosed and confirmed by specialists to have these conditions are given a little extra time, right? Everybody finishes in 1 hour, but we give them 1 hour 30 minutes, right? I think that would help. If it starts that way, then schools can start making accommodation for in their exams, right? But if everybody's going to be given 1 hour for to write the math exam, the dyscalculic, and then the person without dyscalculia, then the school has no business giving them extra time. I mean, during lessons. I don't know if that makes sense. But if it starts from the top, it's a written policy, it's implemented that way, then I think we would move forward. Yeah.
Right. Okay, Doc. Just finally, just before you go, so what would you say to any parent or even an adult who suspects that maybe they or their child might have dyscalculia, but they don't know where to start from?
Okay. So the what I would say is that it can be treated, but the best gift you can give your child, the best gift you can give your child is getting the child help now. Like now, now. You can start from the hospital, right?
Mm.
You want to be sure that the doctor should rule out that the child doesn't have all those other conditions, right? Vision, hearing, cognitive issues. Once that is done and it's established that it's a special learning disorder, you'll be referred to see the hospital who would have a psychologist that you'd be referred to see a clinical psychologist. And I think the help and liberation can start from those quarters.
All right, Doc. Thank you very much for your time and also for the insights you shared. Do you have any final message to anybody? I mean, to our listeners this morning. Just before
So
you go.
that is it. And I would also want to throw in the HPV vaccination that is going on.
Mm.
I mean, from the ages of 9 to 14, I would encourage parents to get their daughters, right? Guardians, parents, get your daughters vaccinated against the human papilloma virus. Yeah.
All right. Okay. Very important. Doc, thank you very much for your time and thanks so much for sharing your insights. Please do enjoy the rest of your day.
Good. Thank you for having me too. Have a great day.
All right. Thank you. All right. So that was Dr. Charles Ahiagbe helping us understand dyscalculia. And he said a lot of things. I'm going to do a quick recap very soon. So please don't go anywhere. I'm going to give you a recap, break down everything that he said for you. But feel free to send us a WhatsApp if you have a message for us. If you want to ask a question, you want to seek some clarity or make a comment on whatever we've shared this morning, 0544321019, 0544321019.